Every last Saturday in April, districts, clubs, Rotarians and partners around the world work on community projects on the same day. This timeless message of compassion and generosity of spirit is called Rotarians at Work Day.
We look at issues of supporting the clinical management of HIV/AIDS. We look at community mobilization for uptake of services at the health facilities as well as community facilities. And we also work with communities to prevent new infections. In this particular scenario, we are actually going out to the communities door to door to be able to access the service to members of the families at a household level, to know their status of the entire household so that they can enroll early into care and treatment.
The package of the HIV prevention that is being delivered to the community is of quality, and also it conforms with the national government guidelines, and also it fits within the Ministry of Health expectations. We have chosen areas which have low access to healthcare services and who actually economically are not endowed.
I work with the community health workers. There are 50 who help me to register the households. I collect data from them. We are looking at the diseases that we can refer to hospitals, the diseases which are very communicable, and also diseases of public health importance.
Magonjwa yenye tunakutana nayo ni kama malaria, unakuta magonjwa kama TB, typhoid, unaweza kuta marasmus. Ukiangalia mtoto unaona pengine ukosefu wa chakula. Poverty ndio inakumba watu wengi, na kama kungepatikana vitu kama neti kulingana na malaria, nafikiri malaria ingepungua. Kama multivitamins ingepatikana, nafikiri tungesaidia kuangalia watoto na kuweza kuwasaidia.
Wengi wao ni wenye wanaendanga wakiwa wagonjwa. Wachache wanaendanga check-ups. Mwenyewe ni kazi nzuri, nimefurahi, nimejua mengi hata yenye sikuwa najua, na ukishajijua utajua venye utapanga maisha yako wewe mwenyewe.
In Kenya, the door-to-door exercise, which was conducted over 3 days in the South Rift Valley, reached more than 8,000 clients, of which 5,000 were provided with HTC services. An estimated 3,000 people were present for the launch of the Rotary Family Health Day, which was held on the 29th of April 2011 at the Rotary Field in Naivasha, hosted by the Rotary Club of Naivasha. It was gratifying to see so many young people attending and participating at the launch. Complementing the HIV/AIDS counseling and testing, the Rotary Family Health Day provided wraparound services which included deworming for all clients, vitamin A supplements for under 5s, antenatal care services, family planning education, provision of insecticide-treated bed nets for pregnant mothers and mothers with young children, sanitary towels for over 300 school-going girls, and screening for blood pressure, blood sugar, cholesterol, and TB.
Leo nilisikia kuna matibabu huku, watu wanapimwa, unajua hali yako. Pia mtoto nilikuwa nimemleta clinic. Pale nilikotoka kuna malaria na kuna watu wengi wameaga juu ya hiyo ugonjwa wa malaria. Nimepata net, takuwa naweka mtoto wangu ndani analala, nazuia malaria.
Health is one of the major components of service that Rotary provides. And all Rotarians should come together with their families and help in providing health or doing issues about health to the community. That's the big objective.
This year we said, why don't we pick something big that can help our country and help the efforts of our government. And we chose on HIV and AIDS testing as a way of us chipping in helping our country.
Ningependa kushukuru sana kwa siku ya leo kwa sababu ni siku muhimu na tena ni siku muhimu kabisa kwa jamii zangu. Kwa vile nimekuja nao pamoja, ninajua nitahudumiwa na huduma yenye iko hapa ni huduma yenye iko free.
Looking at the lines of people that are being tested, looking at the turnout, looking at the families and children that have come, this is really uplifting. We wanted to reach out to those that don't normally have access to services. I think it's been a phenomenal mobilization activity, and this is fantastic. Thank you.
There are 41 Rotary clubs in Kenya, and they're from Maralal to Western Province to Yaya, they're all, and the coast, they're all doing Rotarians at Work Day. So what you're seeing here is just one aspect. We've partnered with many organizations. We hope it'll spread much more awareness, not only among all the people here, which we've done, but also among Rotarians.
Some Family Health Day sites organized football tournaments as part of their mobilization exercise, where participating teams were required to know their status as part of the registration and entry fee. At the University of Nairobi, sports teams participating in the Inter-Campus Sports Day were awarded additional points for HTC participation. At other sites, cancer testing including pap smear and mammography services were offered. Elsewhere, clients were encouraged to know their blood group and donate blood, and youths were encouraged to register to vote. On the Rotary Family Health Day, respiratory infections, diarrhea, skin or eye infections and malaria were treated, and referrals were given to all clients requiring further care. On Saturday, the 30th of April 2011, which is the Rotarians at Work Day, Rotary clubs actively supported by the Rotary Community Corps and Rotary clubs and partners hosted and supported sites that provided HTC services as well as other health services across the country in Kenya. All these activities were made possible with the support of our partners. These include Rotarians for Fighting AIDS, the primary partner of District 9200 in this initiative, the Afia Plus partners, the Coca-Cola Africa Foundation, the Ministry of Public Health and Sanitation, the Naivasha Horticultural Fair, and the Rotary Community Corps and Rotary clubs.